USMLE style question on signal recognition particle, SRP. A 4-month-old infant is brought to the clinic due to poor weight gain and recurrent infections. Physical examination reveals hepatomegaly and failure to thrive. A liver biopsy shows accumulation of misfolded proteins in the cytoplasm of hepatocytes. Further investigation reveals a defect in the translocation of newly synthesized proteins into the endoplasmic reticulum, ER. Which of the following is the most likely underlying defect in this patient? A. Impaired signal recognition particle SRP function. B. Defective mannose-6-phosphate tagging. C. Mutation in the lysosomal acid hydrolase gene. D. Deficiency of ubiquitin proteasome degradation. E. Impaired vesicular trafficking due to copia dysfunction. Correct A. Impaired signal recognition particle function. Explanation. The signal recognition particle, SRP, is a ribonucleoprotein complex that plays a crucial role in protein targeting to the endoplasmic reticulum, ER. It recognizes the N-terminal signal sequence on nascent polypeptides and halts translation temporarily. The SRP then directs the ribosome polypeptide complex to the ER, where translation resumes, and the protein is translocated into the ER lumen for proper folding and modification. A defect in SRP function leads to accumulation of misfolded proteins in the cytoplasm, causing failure of protein secretion, which can result in liver dysfunction, immune deficiencies, and growth abnormalities. Why not the other option? B. Defective mannose-6-phosphate tagging, I-cell disease, causes lysosomal enzyme secretion into plasma rather than misfolded protein accumulation. C. Mutation in lysosomal acid hydrolase, lysosomal storage disease, e.g., Gaucher, Niemann-Pick, Tay-Sachs, leads to accumulation of specific substrates in lysosomes, not defective protein translocation. D. Deficiency of ubiquitin proteasome degradation, neurodegenerative disorders, e.g., Parkinson's, Alzheimer's, von Hippel-Lindau disease, leads to protein aggregation but does not affect ER translocation. E. Impaired copia trafficking, congenital disorders of glycosylation or ER stress disorders, affects vesicle transport but does not directly impact SRP-mediated translocation. Key features of SRP dysfunction: cytoplasmic accumulation of misfolded proteins, impaired secretion of proteins, failure to thrive, hepatomegaly, recurrent infections, defective ER protein translocation. A defective SRP disrupts the normal trafficking of secretory and membrane-bound proteins, leading to severe systemic effects, including liver dysfunction and immune deficiencies.